All righty. Hey there, how you doing today? It's Dan Smith with DSI Marketing Solutions. And today on Facebook Live, we're doing a special Saturday edition, and we have a very special guest with us today. I'm going to bring in Dr. Larry Pawl, better known as Corona Claus to his employees. Welcome, Dr. Larry. How you doing today?
I'm home, staying out of trouble, and actually doing quite well.
Well, good. Well, it's good to see you. Now, Dr. Larry and I met several years ago. We're in BNI together. It's a great place. Of course, it's a little bit different right now having our BNI meetings. We can't go out and fellowship at Marie Callender's, but it's very interesting. It's a great group. But also, Dr. Larry Pawl is just a great person in the community, a great doctor, a great boss to his employees. They will tell you all about it. But also, people don't realize taking care of your gums, your teeth is just as important to immunity health. And we have to think about these things today with what's going on. So I brought Dr. Larry to tell us about what we could do. And also, if you do have a toothache, you can call Dr. Larry and he can help you. So you can't, just because you can't see the dentist doesn't mean to put off that toothache until you can, because they do see you in emergency cases. But I'm gonna let Dr. Larry tell you all about that. Hey, welcome. How you doing? And so tell us a little bit about how you can help people today. Maybe some of the things that they can do in protecting their mouth health, since you can't even clean their teeth.
Well, that's a great question, Dan, and thank you for having me on. What people can do, just like all the things you've been hearing on the radio and TV, wash your hands, wear your masks. But the thing you can do for your mouth is brush your teeth. So there are many studies that correlate your oral health with your systemic or your body health. Especially one of the ones that has been researched a lot is diabetes. So if you are diabetic and your gum health is kind of up in the air, if you look in your mouth and your gums are red and puffy, that's not a good sign. So brushing your teeth, rinsing with warm salt water 3 times a day, that's going to help you out a lot. And if you have problems that are creating pain, you will be getting my phone number and we can chat. You'll get my cell phone number and you and I will talk on the phone and we can determine if this is something we can handle over the phone. Sometimes I even do, nowadays the term is teledentistry, which means you're going to take a picture of your mouth, or someone will take a picture of your mouth and you text it to me. And hopefully it's a nice clear picture so I can see. Use a flashlight to light up the area if need be. And, it might be something that I say, yes, we really need to get you in, and we will then schedule a time to have you into the office. Whereas I'll get hold of my assistant, Linda, and we will meet you at the office and we will get some x-rays, take care of whatever it is, let you know what's going on, possibly some antibiotics, possibly pain pills, maybe even a referral either for extraction or anything else. But we can take care of you one way or another. Even though we're not completely open, we are seeing people on a limited emergency basis.
Well, that is definitely good to know, because I think a lot of people don't realize. They'll just say, oh, well, I'll just wait till the virus is over. But you really can't put off that pain in your mouth if you have it, because it could lead to other problems. So
yeah, having pain, having a toothache really tends to drive people crazy. So I don't want to have people do that. Let's take care of it.
Now, you were recently featured, and I'm going to bring this up for everybody to see. This is your new nickname here, Corona Claus. Generous La Mesa Dentist brings team to tears with delivery of essential goods. And this was a fantastic story. I think you as a business owner, you as a boss, this is a beacon for other bosses. This is something that what you've done. Explain what you did here. I just think people need to hear about what you did for your employees. It was fantastic.
Well, Dan, you're really being way too kind and generous. What happened? We shut down on February 16th, and the team signed up for unemployment, and basically we were gone. We were apart. There are 5 amazing people that I work with that really make my practice run. I mean, yeah, I consider myself the pretty boy in the practice or the pretty face. But the 5 ladies that work with me, they're the key to the whole thing. And I miss them. So we get to share all of our lives every day when we have our morning meeting, talking about how our day is going to go and anything that else comes up. And I thought, I want to bring a smile to their face. I want to surprise them. I want to do something special for them. So I went out and got toilet paper and a box of Kleenex and a Vons gift card and some Starbucks card. And later I gave them a box of masks. And as you can see in the picture, each of them got a bouquet of yellow sunflowers and Gerber daisies. Yeah, yellow is my favorite color, and I thought it'd be bright and sunny and put a smile on their face. And apparently it did. So I went to each of their houses. I surprised them. I called them up when I was right outside their door, and they came out, and I gave them the bag of goodies and the flowers. So that's what I did for them. And then there's just an added part. Just recently, we celebrated the National Professional Assistance Day, and I had a wonderful bouquet sent to each of them using the florist that I've used for years and years, a Cut Above florist. She's up in Alpine, absolutely beautiful, absolutely gorgeous. And each of them called up and said, "Oh, Dr. Pawl, this is way too much. Thank you very much," and sent pictures. So I believe as a business owner, if you're not taking care of the people that take care of you, you're not doing the right thing. And I think it's really important to show appreciation and gratitude, because these people are out of work. They work very, very hard for me. They work very, very hard for each and every patient that comes in. And Dan, you are one of our patients. So when you come in, we are going to give you that personal treatment and do everything we can to take care of you.
Well, I just want to say it was such a heartwarming story. It is something that all business owners should really take to heart, how you treat your employees. And we've been employees before we owned a business. And I think what you showed to any business owner is just basically, hey, at this time especially, your kindness to your employees is so important. And it was a great story. You could read it on Dr. Pawl's website. We did pull in the NBC7 story, so it is there. But just talk to the staff. If you know them personally, you'll know what kind of man he is. If you come to a BNI meeting when we open up at Marie Callender's, you can meet Dr. Pawl personally and see what kind of person he is there. So I just wanted to also let people know, are you able to see people when they get the cold sores? You have a very quick and easy treatment, but cold sores could be wicked. And that is something that people shouldn't put off probably this time of year if they get them, right?
That is absolutely true. We have a special laser that we use, and we have a special laser treatment that we have been using probably for 5 years at least. And it works so very well for people. It stops cold sores in their tracks for many people. It makes them smaller or slows them down for a lot of people. And sad to say, there is a small group of people that it doesn't seem to do a lot for. But again, that is a very small group. Everybody else does get some very good results, and we've got people coming back to us again and again and again to take care of it, and they are so happy that they're able to call us up and we will get them in. That would be one of the things that if you call up and say, hey, I've got this cold sore just popped up, can I come in? We will get you in as quickly as possible.
Fantastic. That's good to know. And I know that's something a lot of people would tend to put off or go to the store and just put a topical, and yet they can come see you and get it pretty much taken care of really quick. So.
Pretty much.
Well, I know that you've got some other interests out there. You are a part of Toastmasters. Can you explain what Toastmasters is? I think a lot of businesses hear about it, but they really don't know what it does for them. And I think you have, you've shared a little bit with me, but can you share a little bit with our audience what Toastmasters means to you as well, as in your practice or how you use Toastmasters?
Absolutely. Toastmasters, I've been a member of Toastmasters for 23 years. And I got into Toastmasters because dentistry is a sales. You have to be able to communicate your ideas and your reasons to this person sitting in front of you, why they should trust you, why they should do the things that you are recommending that would help them. In my younger years, I would give them all the doctor talk, and I would tell them why specifically. And at the end of the day, I would find very few people signed up. So after a while, business got scary, and I had to do something. So I had read about Toastmasters earlier, and I decided to join. And Toastmasters will teach you how to speak. It'll teach you how to build rapport. It'll give you confidence. It'll give you all the voice inflection and the gestures and leadership abilities and listening abilities. It is so multifactorial, multidimensional. It's amazing. I tell people, if you are anybody in business, join Toastmasters. You will learn so much, and it will improve your life. It'll improve the way you communicate with your team. It'll communicate how you communicate with your family. So many different levels. It is absolutely wonderful. And I stress it in my own practice, the communication skills and the gestures and voice inflection. So that comes across with my staff. So we build rapport, we build trust very, very quickly. But the bottom line is I've got great staff. Even if I didn't give them these ideas and tips, they'd be doing it anyway. It's just better now.
That's great to hear. I think I might have to check out Toastmasters here. You've talked to me about it, but I think here, when we get to be able to go to Toastmasters, you took on and started doing something new. You are doing dental implants, and your staff has been highly trained. You were trained, so you're now doing dental implants in your office. Can you tell a little bit about what you're doing there and how beneficial that has for the person that has that missing teeth, and what you guys are doing, because this is a new area for you in the last year and a half or 2 years. Is that correct?
Right. we've been doing implants for 2 years now. And I never thought I'd be doing implants or wanted to do implants. It just seemed like a bunch of tinker toys, and there were so many pieces and parts, and none of it seemed to fit together where it made a cohesive amount of sense to me. Even so many other doctors were doing them. But a friend of mine, a classmate, called me up and said, hey, I'm putting on this implant course. I'm inviting some of the local classmates to it also. I'd like to have you there. So my idea, and it was a 3-day class, my idea was to go there and just listen to what he says, but basically it was going to be like, like a mini class reunion. And that was my idea. But at the end of the first day, actually, I take that back. At lunch on the first day, I start going, this is interesting. So then I really, really started paying attention and thinking ahead. Could this be used in my practice? Would I be comfortable doing it? And by the end of the first day, when we were having dinner, we went out to this restaurant, and I got there first, and I was just sitting there, and I'm pondering it, and I'm mulling it over, and I'm going, should I do it, not do it? Got on my phone, and I made a group text to my whole team. And I said, I never thought we'd do this. We are now going to start doing implants. And I got such a positive response from all 5 of them, coming back and forth saying, yay, Dr. Pawl, great idea. We'll really make this work. So I've had 2 of my team members take some really advanced training up at the home base up in Sacramento. I've flown to Korea to be at the International Implant Symposium on this specific implant type. Met with the South Korean doctor that invented. The man is just brilliant. He's an engineer, dentist, 146 patents on this implant system alone. And it is wonderful. Are there some areas that I'm still not comfortable with? Yes. But I have people that I can refer to, that I trust, that can take care of those areas or situations. I tell people one of my greatest benefits that I can pass on to my patients is I'm not God. I can't do everything, but I know what I'm good at. I know what I can do very well. Because I have to be, if I do a root canal, or I do an extraction, or I do an implant, or anything else, that there is a specialty, I have to be held to the same level of quality standard of care as that specialist. So if there's things that are a little iffy, I'm going to tell my patient and say, you know what? I don't want to get in the middle of this and go, oops, I'm stuck. I want to be able to say, you know what? I can see this. This is a situation for someone who has more experience. And that's how I help my patients. I'm brutally honest with them, saying, this would be the best thing for you to do. This is the best person for you to see. I don't do it for the money. There's so many cases that if I was just doing it for the money, the case would turn out completely different. I want the person taken care of. My whole team wants the person taken care of first, and then we come back. I mean, we've had case after case where we delayed treatment or put off treatment because we're sending the person back to their cardiologist because we found out that they've got high blood pressure and they didn't know it. but they're on high blood pressure medication. One of the biggest medications we've seen is the Lipitor. So many people are on that. And so many people, it doesn't work. Now, it may be that coming to the dentist, you can produce what's known as a white coat syndrome. So you go to the dentist, you're a little nervous, and your blood pressure gets a little higher. We understand that. So that's why we take your blood pressure 3-4 times to get a baseline. But if you're still high, we send you to your MD to get this looked at, because maybe Lipitor isn't the right thing, or you need something else, or you need something more. If that wasn't the case, if we didn't have the person's overall health taken into consideration, forget it. We just start drilling and filling. We want to make money, get all that paperwork into the insurance company so that they can start sending me checks in 2 weeks. That's not how we run things. We take care of you. First time on this, so I don't know where my hands are going. We take care of you, and then we take care of everything else.
Well, that is a great way to let everybody know Dr. Pawl and his staff will take care of you. And, just one of the things is if you were to call Dr. Pawl at 619-466-4544, that's where you can reach Dr. Pawl at LarryPawlDMD.com, or just search Google Larry Pawl and it will come up, and you can contact him when you have an emergency and get taken care of by him and his great staff. But then when this is all over and you need a teeth cleaning, you need to follow up, you haven't had one in maybe a year, this is a great time when we do get out to get your teeth cleaned. Take charge of your oral health, because it plays an important part with our body health. And that's the first thing we're putting food right here. So we got to take care of our teeth and our gums. So it all starts there, and Dr. Pawl and his staff can make sure that you are well taken care of at the very critical part that is your oral health. And I think it is so important. And plus the fact that Dr. Pawl is caring enough that he's going to make sure that you're medically good. No dentist has ever done that. I'm going to tell you right now, I've never had a dentist do it. Dr. Pawl will make sure that you're right. The white coat syndrome is true, but you know what? He doesn't want to get in there, and then you have a problem. So this is what a caring individual, a caring doctor is. Dr. Pawl is an exemplary expert in dentistry. He's a caring doctor. His staff is great. I know them. They're wonderful people. So please give Dr. Pawl a call. If you have any toothache right now, don't put it off. Give Dr. Pawl a call today. So Dr. Pawl, do you want to say anything as we close off here today? And again, I wanted to thank you. So let you have the last word here.
Again, Dan, thank you. Very, very kind words. If you do call, you'll be getting our message machine. Leave your message. Say on there you found us through the Facebook Live. My office manager, Stephanie, is checking the machine many times a day. She'll be contacting you. She'll be getting the initial information from you. And then if it's something that needs my input on it, then that gets up to me. So it is a multi-step, but you will be getting somebody within a short period of time. And also on the message machine, if you are having pain, it gives you my cell phone number. So if it's something very dramatic, very distinct, call my cell phone number. If it's you broke a tooth, but it's not hurting, something else, leave a message. Stephanie will get hold of you. And in closing, Dan, I used to play drums all through junior high, high school, and college. I can only see part of that drum set in the background, and I am just drooling. I would love to get on that thing. Thank you very much.
Well, when the social distancing is up, we are planning to have a party. This is my new office here. We did move in April. So we're going to have everybody over. We have a lot of birthdays we missed during this lockdown. So we're going to just have a big shindig. So you're more than welcome. We'll invite you, your staff. We're excited. We're ready to have this thing go. But in the meantime, thank you so much for joining me today. Thank you, Facebook Live community. Again, just give Dr. Pawl a call. Go to LarryPawlDMD.com. Start there, and you will find the right dentist for you, the great staff. All right. Thank you so much. And you guys have a great weekend. Bye now.